Hello, it's Dr. Eve here, also known as Dr. Yvonne Abimnola, and welcome to Heal. So this is module 5, and we're going to be talking about skin health in Black people. And we're going to do a special focus on conditions that more commonly affect Black skin, such as eczema, seborrheic dermatitis, acne, and also skin cancer. So first, let's talk about the skin and what we know about it. So our skin serves as much more than just a barrier of defense, and is actually a very good reflection of our general well-being. One of the things I love about skin so much is that it's an external manifestation of internal processes. So it's really good to get into some of the topics that affect us and how we can address these. So firstly, what is eczema and how does it affect Black skin? Eczema is a chronic skin condition which causes dry, itchy skin and also rashes. It can be much more prevalent in Black skin due to genetic factors and also due to the fact that we have less ceramides which hold moisture in the skin. And this essentially can dry out the skin and make us more prone to eczema. Harsh skincare practices in our particular communities worsen this and then also cause more sensitive skin, which links us to eczema. And in Black skin, a rash can look much more aggressive, much drier, and making it challenging to detect, especially for some of our colleagues who are not used to dealing with Black skin. This leads to delayed diagnosis and then, unfortunately, sometimes poor treatment. So, how do we manage it? Eczema is managed in many different ways, and there are some different things that we would ask you to do. So, practical tactics include identifying your triggers. So, is your eczema triggered by certain foods? This might be something that you might want to consider. So keeping a diary of your foods, environmental factors, flare-ups, these are really, really helpful. Additionally, the power of moisture is absolutely cannot be understated. Keeping skin properly hydrated and moisturized with regular moisturizers also helps to reduce dryness and lessen eczema flare-ups. So looking for products that are not fragrance and hypoallergenic. And also sometimes that doesn't mean natural products, but doing things to help to engage the skin to keep it moisturized. And that also might mean medical treatments. So although you are doing all the things that you should be doing with hydration, medical treatment can also be very useful. And you may still have to have a flare-up, so therefore treatment with medication in the form of creams usually is the best way to do this. And we can do this in a variety of different ways. Seborrheic dermatitis is similar but not quite the same thing as eczema, and I frequently hear it described as eczema of the scalp. Essentially, people of African descent frequently experience this condition because, of the skin type, and also that it can become very extremely uncomfortable and upsetting for their skin. It causes flaking, which resembles dandruff, which you often all know about, but the skin and the scalp also gets very inflamed, which can appear red, or for some people just looks a bit darker and give a very greasy appearance. It may also require more frequent washing of the scalp and also can affect other areas of the body, including the face and the chest and other parts of the body. So therefore, you might need much more treatment. And because of the fact that it affects the sebaceous glands, where essentially this yeast, which is called malassezia, builds this up, it needs more treatment. So again, it can be very helpful to identify triggers which may be making this worse. So why do Black people get seborrheic dermatitis? That's obviously quite an interesting question. And seborrheic dermatitis is still quite a complex condition, which is not fully understood. But we know that there are many factors at play. The yeast, which I mentioned earlier, is called malassezia, which builds up on the scalp. And this causes increase of seborrhea, which is the flakes that we see, and yeast, and it makes it grow more and also causes the scalp to be a lot more oily and greasy. There's also an element of genetics, and we know that seborrheic dermatitis is much more common in people who have experienced it before. So they might have their parents have had it, or their brothers or sisters, and has a quite strong inheritability. It doesn't mean you inherit it from your parents, but you do have more tendency to have it if it runs in your family. Environmental factors also worsen seborrheic dermatitis. So we know that you're likely to experience a flare-up when it's cold, the weather is drier, and this can make the symptoms worse. Additionally, like a few other conditions, stress and exhaustion can also make these flare-ups much more persistent and essentially make the symptoms worse. So we always advise patients to adjust their lifestyle in order to improve their stress. A very important factor for us as clinicians to be aware of is other conditions which may be linked to seborrheic dermatitis. So seborrheic dermatitis is more common in other people who have conditions like HIV, Parkinson's disease, and even depression. So that just goes to show you how complicated the condition is and why it can be very difficult to manage. So let's talk about management. Management of seborrheic dermatitis can be done very, very practically. And actually, lots of the treatments are available for you to carry at hand in the shops. So things include medicated shampoos. Some of my favorites are things like Nizoral and other things that you can buy in the shops. Also, there are topical antifungals, which we like to use, which work to reduce the yeast burden on the scalp. Where the scalp might be itchy and inflamed, we also may use topical corticosteroids, which essentially are steroid treatments to help improve the scalp. And additionally, things like calcineurin inhibitors, which are non-steroid based treatments, again addressed to improve flare-ups and manage the scalp. In some cases where the scalp or the body is very, very severely affected, it may be appropriate to prescribe oral antifungals, and that can be very, very helpful in managing the condition. And for a few number of patients, they may require additional aggressive treatments, which are not something that are available to most people, but within secondary care, phototherapy can also be used. Now, what is acne and how does it affect black skin? Acne, aka pimples, result from clogging of the pores and of the hair follicles under the skin. It can present as small to large and even medium-sized bumps on the skin, which can sometimes be painful and also can be pus-filled. We call these pustules, and this can be very disfiguring for some people. Apart from being common in black people, the main concern I find patients often struggle with is the hyperpigmentation which is left behind after the acne has responded to treatment or has decided to go away. And hyperpigmentation is essentially those black or red or discolored areas of skin, which is where the acne was as the skin starts to heal. And this is caused by an inflammatory process and how the skin chooses to heal in these cases. So, what do we know causes acne? Well, again, unfortunately, this is a complicated matter, and it's a complex distribution of things like excess oil production, build-up of dead skin cells, a particular bacteria we know as C. acnes, and also hormones. So for some people, the build-up of hormones in their body can also contribute to acne and make the acne far worse. So it's certainly important for us to be able to address these. How is acne managed? Again, we have a few things in our armory in order to address acne. So we might be able to do this in the form of topical medications where we apply creams to the face. It can be really effective if your acne is only limited to your face. Some people, acne can be much more severe and also cause scarring. So we might consider oral medications, which can be really helpful in order to manage the acne. And additionally, for some people, normally, in some cases, they would seek private treatment, but procedures can be very helpful in the form of laser or chemical peels in order to address acne. And essentially, that's to tackle the active acne and also sometimes to tackle the consequences that acne has left behind. But what we know for sure is that prevention is key. That essentially means we need to do things like regular cleansing, and if you can, double cleansing in order using something like a mild, non-acne causing, or we call non-comedogenic cleanser to wash your face at least twice a day. And where you can, in the evening, when you've built up lots of sweat and dirt and debris from the skin, using 2 different types of cleansers to clean the skin is really helpful to remove oil and dead cells and all the skin products that you've put on and makeup, for example, to avoid the pores from being blocked up. Additionally, hydrating the skin and making the skin very nice and hydrated, maintaining this can help your skin from producing too much oil. Even if you think your skin is oily, doing that is still important. So putting moisturizer on is really helpful. And for my oily girls and boys, opting for an oil-free moisturizer specifically made for acne-prone skin is a way to achieve this. For all skin types, whether you are the lightest the light or the darkest the dark, sun protection is key. Excessive sun exposure can actually make a form of acne and also worsen hyperpigmentation. Therefore, you are actually doing yourself a disservice if you don't use sun protection, because it can cause hyperpigmentation to worsen, darken acne scars, and cause a form of solar acne, which is essentially a terrible cocktail of problems that you're causing for yourself. And so that means wearing sunscreen on a cloudy day, on a rainy day, and not just waiting for the sun to be shining. And using an SPF, so a sun protection factor of 30 and above, is essentially what we would advise all people to do. And you can do this without getting that nasty white cast. Finally, exfoliation is another way to prevent acne from becoming a problem. And we do this by removing the skin cells which are dead on the skin on a regular basis, so in your cleansing process. This doesn't mean scrubbing your face. This means using key ingredients to be able to remove those dead skin layers and avoid irritation of the skin. And that way you avoid aggravating the skin and causing more acne. But it's very, very important to be gentle to your skin. Be kind to it. You'll only have it for a while. So let's talk about skin cancer, because often people feel that it doesn't affect black skin. And unfortunately, that's something we really need to bust as a myth. Due to higher melanin levels in the skin cancer might be less common in black skin, but it certainly isn't something that we are completely excluded from. And the problem is that when it does occur, it tends to be very aggressive and often is detected later because we're not looking for it. This leads to less favourable outcomes and higher mortality rates. Melanoma in particular is the dangerous form of skin cancer, which often appears on less sun-exposed sites. So not the places that you're expecting to see. And often we find this in places like the nails, it can be under your feet, it may be in areas that you weren't expecting. We do know that common skin cancers such as basal cell carcinomas, which are often associated with sun, and squamous cell carcinoma can also affect black people, but it looks slightly different, and we often see these as pigmented forms of skin cancer. So very, very important to make sure that you consider things like your nails, your mucous membranes, that means inside, mouth and other areas, and soles of feet and palms. And this is actually one of the things that unfortunately took Bob Marley away because he wasn't aware of it. So we need to be aware of it too. So, what causes skin cancer? Skin cancer can be attributed to things like genetics. So if you have a family history of skin cancer, you're at higher risk of developing skin cancer. And due to this is something that we really need to be aware of. Excessive sun exposure or use of tanning beds, which is a complete no-no for me as a clinician, is another risk that increases your risk of skin cancer. If you may have had treatment for another condition, such as cancer, that required irradiation in the form of radiotherapy, unfortunately, this can also increase your risk of skin cancer. So again, this is something that we really, really need to be aware of. And finally, things like injuries to the skin or persistent inflammation or wounds that don't appear to heal can also be a sign of an underlying skin cancer or a risk of a skin cancer developing there. So all of these things are things that should advise you to seek medical attention to be able to identify whether or not there might be a skin cancer there. Okay, so let's talk about the management of skin cancer and how we manage it commonly in clinical practice. So in most cases, if we identify a skin cancer, we want to cut it out. So surgical methods are the main way that we do this. Additionally, we might decide to use chemotherapy, and chemotherapy involves using medication in order to target skin cancer cells and kill them from the body. Additionally, we may also apply radiation therapy, and this can be done in combination or in isolation depending on the type of skin cancer that you have. And now we have other types of therapy called immunotherapy and targeted therapy, which also can address skin cancer. And what we do is we determine this the main way of managing the skin cancer by the type and the stage of the cancer. And in order to do this, you would see a specialist. The likelihood of successful treatment and survival can be significantly determined and increased by early detection. So I think the important thing to hear is that consider cancer. Unfortunately, we have to. Early detection will save lives, and we can give you far more options in terms of treatments in order to identify and manage skin cancer. Now let's talk about skincare for black skin. It's very, very important for everyone, but particularly us, as we're talking about healing here, to get a proper skincare regimen in order to keep the skin healthy and radiant. So here are my 5 steps for how to do this. Step 1, cleansing. And cleansing with a regular, gentle, hydrating cleanser, or using a cleanser based on your needs. So if you have an oily skin type, choosing a cleanser that addresses that can also be really helpful. Avoiding abrasive soaps that deplete the skin of its natural oils is really, really important, because this can cause dryness and increase actual sebum production, so make you much more oily. And then choosing cleansers that help to keep moisture in the skin, such as cleansers which contain things like glycerin and ceramides, which hold moisture, and hyaluronic acid, which are all things that boost moisture in the skin. Secondly, exfoliating the skin is helpful to remove dead scales and to unblock clogged pores which cause acne. And this can be done with exfoliating cleansers or toners, but it doesn't require scrubbing of the skin. So a gentle exfoliant is required because black skin can actually scar and cause more irritation and inflammation in the skin. Additionally, you can use a toner for some of your skin conditions or skin needs, and this can also combine with the exfoliants. So some treatments available on the market operate as both the exfoliant and also as a toner. As we mentioned before, moisturizing the skin is very, very important in order to be able to keep the skin hydrated. And in doing this, we can help to boost moisture in the skin and prevent the skin from becoming damaged. So we look for things that are humectants, which pull moisture into the skin and help lock it in there. Sun protection, as I always say, is really, really important. No matter the weather, you must wear a broad spectrum sun protection factor of 30 and above. So that's something that would give you good protection, but you must also remember to reapply every 2 to 3 hours. And especially if you get in the water, you need to reapply your sunscreen. That doesn't mean you shouldn't also wear things that protect the skin from the sun, like a hat or sun protective clothing, but the main thing is that you're wearing sun protection. Remember, regular skin cancer screening is really, really important as well. Okay, so let's talk about why black people should practice regular skin cancer screening. And although this is not something that is always done as a routine part of government protocols, it's something that you should take consideration for. So firstly, early detection. Repeated screenings aid us to be able to find and detect skin cancer earlier. And this allows us to lower the possibility of serious complications and a late diagnosis of skin cancer, and therefore improve the prognosis of your diagnosis if it is found. Prevention is always better than cure. So therefore, preventative care in the form of routine examinations can also help us to spot precancerous changes in the skin and enable us to get treatment before cancer takes a hold. So seeking your primary care practitioner, if you notice something that changed in your skin that might be concerning, is really, really an important way to do that. Finally, I just want to talk about the final things to leave you with today. Remember, consistency. This is key when it comes to skincare. The texture, tone, and general health of your skin will improve if you stick to a good skincare routine, and it will thank you for it. It's very, very important to stick to a skincare regime, and if you do need to change it according to the change in temperature or environment or whatever the case may be, that's fine, but consistency is necessary to have healthy skin. It's also critical to build a relationship with your primary care practitioner or your dermatologist and schedule routine checkups to be able to track and review for any changes or developments in your skin, and also for you to spot those too. Always remember, prevention is better than cure in maintaining your overall health and especially that of your skin. I want to thank you so much for listening today, and thank you to Dr. Show for this opportunity. Have a great day.